Hey there! Today we're diving into a topic that a lot of people are curious about, but not everyone talks about it openly: HPV or Human Papillomavirus. It's super common, and understanding it can literally help save lives. So if you've ever wondered what HPV really is, how it's transmitted, what the symptoms are, or how to protect yourself, you're in the right place. Before we get started, make sure to subscribe if you're into science-based, easy-to-understand health content. Okay, let's start from the very beginning. HPV stands for Human Papillomavirus. Now, despite the name, it's not just one virus. It's a whole family of viruses, actually over 100 different types. Some of these viruses cause things like skin warts on your hands, feet, or face. But about 14 of them specifically affect the genital area, and these are the ones we usually worry about in sexual health. Why is HPV important? Because some types are harmless and just cause warts that go away on their own, but others, called high-risk types, can cause serious disease like cervical cancer and even throat cancer. So while HPV can seem like no big deal, at first, it can sometimes lead to life-threatening complications years later, and if it isn't detected or managed. Here's a surprising fact. Most sexually active people, we're talking more than 800s, will get HPV at some points in their life, usually in their teens or 20s. And the majority of them won't even know they had it, because in some cases, there are no symptoms at all. That's why HPV is often called the silent infection. Scientifically, HPV is a DNA virus. It targets the epithelial cells, the cells on the surface of your skin and mucous membranes, like the mouth, throat, cervix, vagina. It enters the body through tiny cuts or abrasions, often during sexual activity or even close skin-to-skin contact. Once inside, the virus can either be cleared by the immune system or hide silently in the body for years, or if it's a high-risk type, slowly cause abnormal cell changes that might turn into cancer. So, now that we know what HPV is, let's talk about what happens inside your body when you get it. At first, HPV is DNA virus, and it loves epithelial cells. These are cells that line the surface of your skin, as well as mucous membranes, like the mouth, throat, cervix, vagina, penis, and anus. HPV usually enter the body through tiny cuts or microabrasion in the skin or mucous membranes, often during sexual activity or skin-to-skin contact. You won't feel it, you won't see it, but once it's in, it starts doing its thing. The virus targets basal epithelial cells. These are the deepest layer of the skin or mucosal tissue. HPV doesn't enter the bloodstream like some viruses. It stays localized in the skin or mucous area where it entered. Once it infects the cell, it uses cell's own machinery to make copies of itself. Now, depending on the type of HPV, two things can happen. If it's a low-risk HPV type, like type 6 or 11, the virus causes the infected cells to grow faster than normal. These lead to the formation of warts, either on the genital, anus, or sometimes even the mouth and throat. These are non-cancerous and often go away on their own, though they can be annoying or embarrassing. If it's high-risk type, like 16 or 18, the virus can cause changes in DNA of the infected cell. Over time, sometimes years later, these changes can lead to abnormal growth and eventually cancer if it's not caught and treated early. This is especially true in the cervix, where HPV infection can lead to cervical cancer if it's not detected with regular screening like pap smears. But here's a twist. In about 19% of cases, your immune system is strong enough to recognize the infection and clear it out within 1 or 2 years, without any treatment, and without you even knowing you had it. But in the remaining 10%, especially when it's a high-risk type, the virus can stay hidden and that's where problems start to build over time. HPV is very smart. It avoids triggering a strong immune response because it doesn't enter the bloodstream and doesn't cause inflammation, so your body may not even notice it's there. That's why screening like pap test and HPV DNA test is so important, because your body might not alert you. Now let's talk about something that makes HPV so common: how it spread from person to another. You might think it's probably like other STDs, only through unprotected sex, right? Well, not exactly. Unlike HIV or hepatitis, HPV doesn't need blood, semen, or vaginal fluids to spread. It's transmitted through direct skin-to-skin contact, especially in the genital area. Anyone who's sexually active, regardless of gender or number of partners, is at risk. Even people with just one lifetime partner can get HPV if that partner has it. Can HPV be transmitted non-sexually? Rarely, yes. For example, a mother can pass it to her baby during vaginal birth. This is extremely rare, but it can be lead to something called recurrent respiratory papillomatosis, where warts grow in the baby's throat. What makes HPV spread so easily? It often causes no symptoms, so people don't know they're infected. It can stay in the body silently for years, even after symptoms go away. It's spread through skin contact, which makes it hard to completely avoid, even with protection. So yes, you can't always tell if someone has it. Even you might have had it at some point and never known. What are the symptoms of HPV? Alright, so now that we know how HPV gets into the body, the next question is, how do you know if you have it? Well, here's the tricky part. In most cases, you don't. HPV is often completely silent. That means you could have HPV and feel totally fine. No pain, no fever, nothing. And that's exactly what makes it so easy to spread and so dangerous in the long term. In fact, most people who get HPV never show any symptoms at all, and the virus clears on its own, especially in younger people. But in some cases, symptoms do appear, and when they do, they depend on the type of HPV, the location of the infection, whether your immune system can control the virus or not. Low-risk types like HPV 6 and HPV 11. These are the ones that usually causes warts. Here's what to look for. Genital warts, small, flesh-colored or pink growth, maybe flat or raised, sometimes appear in clusters like cauliflowers, usually painless but can be itchy or uncomfortable. Throat warts. In rare cases, HPV can cause warts in the mouth or throat. High-risk types like HPV 16 and HPV 18. These usually don't cause warts, but silently lead to cellular change over time, especially in the cervix, anus, or throat. That's why we call them the invisible danger. You usually won't feel anything unless the infection has been around for several years, leading to cancer. In women, no visible symptoms in early stage, but can be detected through pap smear or HPV DNA test. Later signs of advanced disease may include unusual vaginal bleeding, pain during sex, pelvic pain. In men, usually asymptomatic. In advanced cases, lumps or sores, pain or bleeding from the anus or penis, difficulty swallowing if it's in the throat. Can children show symptoms? In rare cases, babies born to mothers with genital warts may develop throat warts, which can affect breathing. This condition is called RRP, but again, it's very rare. How is HPV diagnosed? Okay, so we've talked about how HPV works and what symptoms it might cause. But since most people don't have symptoms, how do you even know if you have HPV? Well, here's the truth. There's no simple blood test for HPV. Diagnosis depends on where the virus is in your body and what kind of HPV you might have. Let's break it down by gender and risk level. Diagnosis in women. Women have access to routine screening tools that can detect HPV or even its early effects before symptoms appear, like Pap smear. This is a test that checks for abnormal cells on the cervix. It doesn't detect the virus itself, but it shows whether HPV has caused any cell changes, which can be warning sign of precancer. Recommended every 3 years for women aged 21 to 29. From age 13 onward, often combined with HPV testing. 2. HPV DNA test. This test looks directly for high-risk type of HPV like 16 and 18 in cervical cells. It can detect the virus even before any cell change happens. Usually done alongside the Pap smear, helps doctors decide if you are at risk or developing cervical cancer. Colposcopy if Pap smear is abnormal. If your Pap test shows abnormal result, your doctor may recommend to colposcopy. That's a procedure where the cervix is viewed under the microscope and small samples may be taken. Diagnosis in men. Here's where it gets complicated. There's no approved general screening test for HPV in men. That means most men never know they have it, unless symptoms like warts appear. If warts are present, a doctor can usually diagnose them just by looking. For men with HIV, some clinics offer anal Pap smear to detect a change caused by HPV similar to cervical screening in women. But for most healthy men, there's no routine HPV testing unless symptoms develop. But again, there's no standard test for this. Doctors usually detect oral HPV only if symptoms show up. HPV in the mouth and throat. HPV can also infect the oral cavity and throat, especially like persistent sore throat, hoarseness, or lump in the neck. In such cases, they may do biopsy of suspicious tissue. So now that we know how HPV is diagnosed, let's dive into something super important. Not all types of HPV are the same. In fact, they behave very differently in the body. Some are low risk, meaning they might be annoying but not dangerous. Others are high risk, and they're the ones that can lead to cancer if left unchecked. Low risk HPV types. These types of HPV usually causes warts, not cancer. They don't change your DNA, and they usually don't lead to serious disease. The most common low-risk types are HPV type 6 and HPV type 11. Together, these two types cause about 19% of all genital warts. They cause genital warts, anal warts, throat warts, in rare cases. A rare condition where warts grow inside the airways, usually in children born to infected mothers. These types are non-cancerous, but they can still be emotionally distressing and uncomfortable. High-risk HPV types can cause changes in cellular DNA over time, and that's why may lead to precancer and eventually cancer. There are about 14 high-risk types, but the most dangerous are type 16 and 18. Together, these two types are responsible for about 17% of cervical cancer cases worldwide. High-risk HPV doesn't just live in the outer skin like the low-risk types. Instead, it can integrate its DNA into the DNA of your cells. Once that happens, the infected cell may start dividing abnormally, and over time, this can turn into dysplasia, abnormal precancerous growth, and then cancer. The process is very slow, but without regular screening, you might never know it's happening. Scientists categorize HPV types into 3 main groups based on their cancer-causing potential. 1. Low risk. Cause warts, no cancer, including type 6 and 11. 2. Possibly high risk, are still under risk. 3. High risk, strongly linked to cancer. Vaccines like Gardasil 9 cover both low risk, include 6 and 11, and 7 high-risk types, including 16 and 18 types. How the body responds to HPV. So here's something really fascinating, and honestly, kind of hopeful. Most people who get HPV never realize it. Why? Because the majority of cases, your immune system takes care of it on its own. When HPV enters the body, usually through tiny cuts or skin-to-skin contact, it starts infecting epithelial cells. These are the surface cells of your skin and mucous membranes. But unlike viruses like the flu or COVID-19, HPV doesn't enter your bloodstream, and it doesn't cause a fever or inflammation. And here's the trick that makes it harder for the immune system to even notice it's there. In about 19% of cases, especially in younger healthy people, the immune system detects and eliminates the virus within 1 or 2 years. No symptoms, no treatment needed. You may never even know you had it. Your body produces specific immune cells and antibodies that recognize the infected epithelial cells and gradually remove them. This is why for many people HPV is temporary and never cause any problem. Sometimes the immune system can't fully clear virus, especially if the person is immunocompromised. The virus is a high-risk type like 16 or 18. The infection has been around for a long time without detection. In these cases, the virus persists silently. It stays hidden in the tissues and can slowly start causing cell changes, which may eventually turn into precancer or cancer. And the scary part is, you still won't feel any symptom while this is happening. Can HPV come back after it goes away? Yes, and here's why. HPV can go dormant. That means your immune system suppresses the virus, but it doesn't completely destroy every trace of it. So in some cases, especially under stress, illnesses, or immune suppression, the virus can reactivate years later. It's rare, but it's possible. The HPV vaccine doesn't boost your immune system in general. It trains it specifically to recognize and attack the most dangerous HPV types before you ever get infected. So if you're vaccinated, your body will have antibodies ready to fight off HPV as soon as it enters. How to stay safe? The best prevention is vaccination. The HPV vaccine, like Gardasil, protects against the most dangerous types of HPV, especially 16 and 18. It's recommended for girls and boys around age 11 to 12, but even adults up to age 26 or even 45 can benefit. Boost your immune system with a healthy lifestyle, routine screening. What about the treatment? There's no cure for the virus itself, but warts can be treated with creams or minor surgery. Precancerous lesion can be removed. Cancers caused by HPV are treated like the other cancers, with surgery, chemo, or radiation. If this helped you understand HPV a little better, hit that like button, share it with someone who might need it, and don't forget to subscribe for more straight-up medical info. If you got any question about HPV, drop them in the comments. I read everything. See you in the next video.